Welcome to Peak Health. We're excited to welcome you to this training video. We've recently completed 6 online live portal demonstrations and wanted to have the access for this training video to be on our website, to be accessible to peak providers 24/7. The purpose of the next few minutes is to provide a brief introduction to our different departments, along with an overview of the guidelines of our operation. The main topic of this video is, though, to provide a live demonstration of our TapLink provider portal. Peak Health was founded last year, 2021, is headquartered here in Morgantown. Our mission is to make healthcare more accessible, understandable, and collaborative. We are owned by WVU Medicine, Mountain Health Network, and Marshall Health. Insurance services. We are an insurance service company providing claims administration for self-funded commercial clients. We have nearly 100 employees and will be fully staffed by 1/1 of 2023, with a focus on building jobs here in West Virginia. Our different department heads and Kara Nelson, our systems analyst, have developed the majority of the information that you're seeing today. My name is Michael Delegati. I am the manager of network services for Peak Health. Brandy Cope is the director of medical management. Kathy Postlethwaite is the manager of claims, and Stacy Schiffauer is the manager of member and provider services and our call center. Our call center, the Peak Health call center, supports both member and provider service calls. The 1-833-9-MY-PEAK number is for provider service calls. Operational hours are Monday through Friday, 8 a.m. to 5 p.m. Eastern Time. After hours calls are recorded for both provider and member lines, and service representatives respond to these inquiries by the next business day. Provider inquiries can be sent to Peak Health Provider Services via the TapLink messages. Claims inquiries, payment and benefit related questions, patient enrollment, all of these things can be done on the provider portal that we will demonstrate very soon. Our claims department, our operational goals are to have a 98.5% auto adjudication rate with a less than 1% rejection for manually entered claims. Our claims processing turnaround time is within 30 days for in-network and 45 days for out-of-network. CRMs are created for claim review, and they are resolved within 5 days. Timelines and thresholds. Claims, our timely filing limit is 365 days from the date of service. Our appeals limit is 180 days from the date of denial. Optum CES is our code editor, and Olive is our clearinghouse. Again, Peak Provider Services can be reached at 1-833-9-MY-PEAK or 1-833-969-7325, Monday through Friday, 8 to 5. Our website is www.peakhealth.org. Claims payer ID is Peak 0. Peak 0. All of our member IDs are numeric. The prefix will start with 164 and works its way up with the suffix of 01 for subscriber, 02 for spouse, and 03 for other dependents. Our medical management department and utilization management will govern and oversee prior authorization list, which will be available on the Peak Health website. Hours of operation for utilization management is Monday through Friday, again, 8 a.m. to 5 p.m. The pre-cert line is 1-844-484-0302. For prior auth requests, and that list will also be on the website. It will cover the general types of procedures, services, DME, post-acute and SNF, hospice, home health, LTAC, rehab, acute inpatient, behavioral health, and medically and clinically administered medications. Lists of codes requiring pre-auth will be available again on the Peak Health website. Our medical necessity criteria is governed by Interqual, and also where policies are required, we have our internal Peak Health medical policies. They will also be available on the website. Appeals must be filed within 180 calendar days of the adverse benefit determination. Urgent and expedited appeals decisions will be rendered within 72 hours. You can request this by calling Peak Provider at 1-833-9-MY-PEAK for an urgent or expedited appeal. Pre-service appeal decisions will be issued in 30 days, and post-service appeal decisions will be issued within 60 calendar days. The peer-to-peer process is available with any adverse benefit determination if that is your request. We have one level of internal appeal and one level of external appeal if requested. Detailed processes are available and outlined in our provider manual, which is also available on the website. So we'll get to the meat of the matter. What is a secure portal? This portal is a site for providers and clinical staff and insurance personnel to view member information, claims, remittance advice statements, authorizations, and referrals in a secure format. And this is a picture of the login page of our secure portal. It is required to obtain access and to log into the secure portal, you will need to request a new account. So you would go to Peak Provider at peakhealth.org. Below the blue or teal login button, you'll see Request New Account or Update Account Access. You would click there and complete the required form, which Kara will go through here very shortly, and then you'll be sent an email confirmation of your sign-in credentials. During the demo of this portal, you'll learn about requesting access, requesting guest claims lookup, how to view coverage information for the members, how to view a claim, how to create an authorization, how to view authorizations for a member, and how to send a CRM via the InBasket. At this time, Kara, I think I will let you take over sharing and demonstrate the portal. Kara Nelson.
Hi, I am Kara Nelson, and I will be going through the provider portal with you guys. So I'm going to go ahead and share my screen here. So as Mike said, this is the login page here. And so we're going to just start out and go through a little bit of this request new account / update account access hyperlink. So like he said, you would click here. And then it brings you to this hyperlink. So it's going to ask you to fill out this form. And then it just asks for some information about you here so that you can be properly provisioned to use the site. So, and I just want to call out down here to have access to the Peak site. You would need to select under the appropriate access you are needing one of these Peak Health user options here at the bottom. Depending on if you would have a need for chart review, you would click this top one. If you did not, you would just click this bottom one here. So after this is submitted, your request would be processed and you would receive the sign-in information via email. I'm going to go ahead and go back and show you some other information on that login page. So once we're back at the main page, I'm going to go ahead and show you guys this feature. This is for guest claims. So if we click this check claim status here, I'll show you what that's all about. So this would be if you didn't have an active account with the portal, you could still go in and look at data about the claims. So we would just need you to put in some of this information. So just to give you an example, I'm going to go ahead and type in the provider NPI because it asks for provider NPI or the vendor tax ID. So we'll go ahead with the provider NPI. Okay. And then it'll give you a green little check mark if it likes that step. So for the second step, we're going to put in the claim ID plus either the billed amount or the earliest date of service. So I'll go ahead and put in our test claim here. And then the billed amount for 95. And we have to tell it that we are not a robot. And then click search down here at the bottom with the little magnifying glass. So as you can see, it pulls up, the payment has been sent, the check number, claim ID, and the net payable. And then there's some other additional information here that you can view. But it does give you a little bit more information if you are logged into the portal, but it does give you kind of the basics here for people who haven't received their credentials yet. Okay, so I'm going to go ahead back to the login page. Just do this. And then and another feature I wanted to highlight here is this verify eligibility status. So I'll go ahead and click into here and show you what that's about as well. So here, if depending on your patient, you would put in their member ID, and all of these with the red exclamation points, that would mean that that information is required. So you would need to enter the member ID, date of birth, the legal sex, and then this other information. You can enter it. It is not required though. And then it's whatever date you want to verify the eligibility for. You would type that in here, or it does give you, the little calendar to pull up and select there. And then you would just, tell it you're not a robot again, and it would let you know if your member is eligible. Okay. So with that, we're going to go ahead back to the login screen again and actually log in and show you what's within the portal. So I'll go ahead and enter my sign-in credentials here. Okay, so within the portal, the first thing I want to show you is how to view the coverage information for a member. So what we're going to do is click the select patient right here to search for one of our patients. Okay, and I'm just going to go over here to search my patients, and these are all of the test patients I have, and I'll go to my recent ones here. So these are the ones we just recently accessed. We're going to go ahead and grab page here, and then we will, you can see there's, the chart review information here if you needed to view that within the portal as well. So that's all in here. But once we go up, you can hover over the icon here that has page highlighted. So you can do that, and then we will go down under patient profile, and you can click coverages and benefits here. Okay, and that would pull up all of the coverages that page has. So if we wanted to view more information about this, so we'll say the Peak Health 90/10 plan. It does show you a list of, some of these details with the subscriber and their subscriber ID, relationship to subscriber, the member ID, the effective dates, and then there's information about the deductibles and max out of pockets here. And then if you scroll down, you can get some more benefit details depending on the specialty here. So it would show you all of that within the coverages and benefits section. Okay, and next we're going to view a claim for the member. So we do already have page selected up here. So we can just hover over that again, and we'll just go under claims. If we want to do claim by member, we can pull that up and see, all of the claims that this patient has. So we'll just go ahead and click on the top one here. As you can see in this activity, it gives you a lot more detail than the guest claims feature that we showed earlier. So it will say the status and the amount billed for still, but then it does give you additional details like the billing information, more info about the coverage and the services and the diagnoses here. So then we can go back. If you want to view another claim, you can click in there, but you can also see, the status, the service from, and claim received date here too. But next, we're going to go ahead and create an authorization. So for that, I'm going to go back home and just show you how to do it from scratch. So as soon as you log in, you can click this big Create Authorization button here. So we'll go ahead and click that. And just for example, I'm going to go ahead and type in for the authorization type. This would be for a physician referral office visit. Um, Here we go. Physician referral or office visit. And then you can click next here at the bottom after we have selected the authorization type we'd like. And then we'll go ahead and enter. It already has the priority filled in for you, the type on this page, and then the dates here. So we'll go ahead and put in our provider. Okay, and then wherever we want to refer them to. So we'll go ahead and type under the vendor here. Okay, and then so we'll go ahead and click next here at the bottom. Okay, and then it will require you to put in a diagnosis. So I'm going to go ahead and put in just headache. We'll just click this top one here. And then for the services, we're going to go ahead and type in MRI brain, for example, and it would pull that up. Click that one there. And it does give you a place to enter notes if you wanted to type something in there to support your authorization request. You could do that there. You could also attach a file to it, if you want to provide some additional information. This is not required though. So after we enter all of that, all you have to do is click the request authorization at the bottom with the green check mark. And it will pull up a sort of report of what you just requested. So you can view all of that information here. And then it does give you an option after you've submitted the request, you can go in still and add a note or attachment in case you wanted to add something after the fact. So once this is created, I'll show you if you want to go up here, because we do still have page selected. You can go under authorizations and click the authorizations by member here. And it will pull up all of the authorizations, which this is the one we just did here. And like I said, it does still give you the option if you wanted to add more information to this request here. And then so for the last piece of the portal demo, I'm going to show you how to submit a CRM, which Mike talked about a little bit earlier. So this would be if you wanted to, ask a question to member services or something. So first we would go to the in basket up here with the envelope. And then you would click new message here if you wanted to start a new CRM. So we'll go ahead and click that. And this works very similarly to email in that it will just, head straight over to the member services provider services line. So if we're going to select a topic, we'll just go ahead and select claim status this time. And then for the subtopic, we'll just do a generic question. And then we'll enter a source provider here. And then it does still have our patient there, which is really nice. But if we wanted to ask about someone different, you could, clear them out, change to a different patient, but we're not going to do that this time. And then it does give you the option to actually attach a claim. So when I click that attach claim, it pulls up all of the claims that page has. So we're going to select, we'll just click this top one again here. And it does, if you just click on that hyperlink, it pulls you into, to give you some information about this claim to make sure that's the one you really want to attach to this CRM message. So if it is, you can go ahead and click attach. If not, you can go back and click the one that you really do want. So we're going to attach here. And then as you can see, it has our claim number and all of this other information down here. So, we're talking about the right thing. So under the details, you can, ask your question. So we see the status is processing. Maybe a question would be like, why is this claim still processing? And then we would click submit here with the green check mark at the bottom. Okay, and then it is sent. So once they receive that message, they can reply to it, and it would actually go here to this customer service reply. So you can click into that folder, and then you would see the message here, So, you would click that message, and it would show similar information here. It would show your message, the CRM number, and then some notes, resolution, things like that. And then you'd have the option to, say, hey, I'm done with this one, or reply to it, or even, start a new conversation. And that concludes the demo of the provider portal. Go ahead and hand it back to you, Mike.
Thanks so much, Kara. That is a lot of information and explained very well. I will share now. What we have here are the tip sheets that are available on the portal under provider services, and they're also going to be available. There'll be tip sheets available on the website, especially to answer questions as far as how to gain access to the portal and answer other questions that are typical. Some of the tip sheets that we have out there now are how to navigate the PEAK portal, how to view coverage and benefit information, how to view a claim for a member, how to create and view member authorizations, and like Kara just demonstrated, how to send a CRM internally. Now, points of contact and resources for Peak Health at this time. For our member services, you'll notice that there's only one number difference between member services and provider services. Member services is 1-833-5-MyPeak, and professional services or provider services is 1-833-9-MyPeak. For IT help, we'll have you call the IT help desk at 304-598-4357. The tip sheets are, like we said, available after logging into the portal under provider support. Also, our website is www.peakhealth.org. Our Peak Provider Secure Portal login is peakprovider@peakhealth.org. And Peak Health's medical management contact information is for utilization management. Again, the hours of operation are Monday through Friday, 8 to 5, with a pre-cert line being 1-844-484-0302. Our appeals and grievances address is P.O. Box 4262, Morgantown, West Virginia, 26504-4262. And the fax number for the appeals and grievances is 304-974-3191. I want to thank you all for taking the time to listen to this training. Feel free to reach out to us at peakprovider@peakhealth.org with questions. We will do our very best to try and answer them. But as you navigate the portal and it becomes more familiar, you'll be amazed at how many different operations you can take care of at the touch of a button now. I want to thank you all for taking the time to listen to this training.